Hi, my name's Lauren. Thank you for joining me today. I'm a cervical cancer survivor and I'm also part of the GRIT team. I want to kind of talk to you a little bit today about my story as a survivor and also my role here at GRIT. So, I was diagnosed with cervical cancer in January of 2016, and that was just 2 weeks after I turned 23. It was completely unpredicted. It was all kind of started by an abnormal pap smear. When I had my abnormal pap, I was just so confused because I had had a regular pap only a year and a half prior. I only got one so soon because my insurance changed. And then I had to go through a colposcopy, which is a biopsy of my cervix. And I then had to undergo a minor surgery called a LEAP, where they took off more of my cervix. And on January 4th, 2016, I went in for my follow-up appointment. And after my exam to see how I was healing, the doctor looked at me and said, "After you get dressed, you can come into my office." So right at that moment, I knew something was totally wrong. So they called my mom back, and I sat in her office, and I still to this day can remember the smell of the leather on her chairs and how sweaty my hands were just gripping onto the armrests of the chair. And it was in that moment that my doctor told me that at 23 years old, I had cervical cancer. But the good news was that it was small and the biopsy they took had clear margins. So she was really happy with it. And she said she'd see me back in 3 months for another PAP. At the time, I was actually working for another OBGYN at a different office location. And he was incredible. He taught me so much as a medical professional, and I got so much hands-on experience with working alongside him in the office and at the hospital. And I kind of told him everything that had happened, and he was like, "Is that really what you want to do?" I said, "You know what? It's not." So I spoke up for myself based off of the knowledge he had given me. And at that point, I asked for a referral to go see a gynecologic oncologist. At the time, I was living in Myrtle Beach, South Carolina, and the closest gynecologic oncologist was in North Charleston. So this was a 2.5 hour drive. So I met with the oncologist, and I remember the look he gave me. He just looked at me like he was so sad. But he was hopeful as well. Because I was so young and because the cancer was caught so early, things would likely end up being okay for me. So him and I, alongside my mom, decided to create a plan. And what I had done was a PET scan. And after the PET scan, he told me that there was indeed more cancer in my cervix. And then I had to get another surgery called a cold knife cone biopsy. And this is a bigger surgery than my first one that I had. And so we had to drive all the way down to Charleston again to have that surgery. And that was actually during March of 2016, which was my very last college spring break. I was still in college when I was diagnosed. And I healed okay from that. It was, a smaller surgery. And then things kind of took a turn from there. I went for my follow-up on St. Patty's Day. So now St. Patty's Day is just forever ruined for me. I can't enjoy it anymore. Because on that day, he told me that more cancer was found, but this time the margins were not clear. in that I was going to have a radical hysterectomy. And I was 23 years old. I couldn't believe this was happening to me. So he said he would give me time to rest and let my body heal. And then on May 20th, 2016, I went back to Charleston and I underwent a radical hysterectomy. In this surgery, they took out my uterus, my cervix, my fallopian tubes, the upper third of my vagina, and 23 pelvic lymph nodes. So I lost my fertility. I had to have a catheter for 3 weeks, so I couldn't urinate on my own. And I was left with nerve damage in my leg from the lymph node dissection. And then I was sitting there stuck, having to recover. I luckily had a really great support system of family and friends that took care of me and made my recovery so much easier. And that was it. There was no more cancer found, thank goodness. None of my lymph nodes were involved. And so on the day of May 20th, 2016, I was cancer-free after that surgery. And now, about 3.5 years later, here I am, and I'm still cancer-free. But that summer, after I healed physically and was gaining my strength back and kind of getting back into the groove of things a little bit, I realized that mentally and emotionally, I was not in a good place. I was mad that all of this happened to me, and I couldn't understand why. None of my friends understood, and I just wasn't happy. So I started scouring the internet for resources and for women that would want to talk about their gynecologic cancers, their HPV-associated cancers. My cervical cancer was caused by HPV. I didn't get the HPV vaccine as a teenager. So I found the group called Cervivor, spelled Cervivor, like a cervix. And I realized that there is a community of women who are talking about their stories. They're not shameful, and they want to make changes. So that's how I got involved with advocacy. I started advocating on college campuses and telling my story in public to not only raise awareness for cervical cancer and regular screenings, but also for the HPV vaccine. If I would have received this vaccine as a teenager, I wouldn't have gone through any of this. We have a vaccine and it prevents cancer. So I just don't get why people aren't giving it to their children. It's crazy. And so throughout that, I became more of a patient advocate and really emphasized that people need to be their own advocate for their own health. You need to ask questions. You need to ask for referrals. You need to look things up, and you really need to deal with trauma emotionally as well. So over the next couple years, I pursued a healthcare career. I was working in a variety of medical offices doing clinical work. And then recently, I stumbled upon grit. And then I started getting involved with grit. And I realized why I was so interested in them and why I was so motivated to help the grit team was grit is run by survivors and caregivers only. And that's what really hit home for me was these people get it. I'm getting the opportunity to work with people at Grit who get it. They get what I went through. They get all of it. They understand it. They've been there. They've done that. Or they care about someone who's gone through all of that. And they're really, truly dedicated to making changes. Changes that are only going to benefit patients when it comes to healthcare and their needs as a patient. So for Grit, I have recently become their new programs coordinator. And so what that means is I link up, essentially, the patients and the people in our Grit community with experts or with resources. So what we do is we have programs which we will host live chats, and in these live chats I will pull in an expert. For instance, we've had these experts come in and have discussions about different topics, whether it's chemo brain, anxiety, exercise, breast reconstruction surgery. And these all happen in real time. These are live chats. That means you as a user can actually go in and have the opportunity to ask questions. There's no script. It's not rehearsed. And you're actually getting to interact with these medical professionals. Additionally, we also team up with nonprofit organizations and have them come in as well and host a program as a live chat. So they come in, they tell the community what they offer, whether it be financial assistance, support groups, learning how to be your own patient advocate, and so many other things. So that's what I do at Grit. I coordinate all of these programs. And I'm also very active on the Grit platforms. You can find me in the app or on the desktop and always chat with me. I'm always trying to meet new people. And so we also host new user nights. And that's where everybody who's new or not new, if you just want to say, hey, can come in and kind of talk and meet people and get the conversation going and show that Grit is a safe spot. You can tell your story. You can ask the questions. We really try to dig into those topics that aren't really talked about. And as a cancer survivor, that's what you need. You need to feel validated. You need to feel like your experience matters, because it does. And so that's why I'm so drawn to working with Grit, and I've had an amazing time working with them so far. And I'm so excited for what we have to offer. We have a lot of great stuff lined up through the end of the year when it comes to programs. And I'm just so excited. And another thing I really appreciate about Grit is that we're so open to feedback. Being the programs coordinator, I am always open to feedback, whether you want to chat with me through one of our platforms, you want to email us, fill out any surveys, let us know what exactly it is that you want from us. We're a community, we're your community, and we're here for you. And that's what Grit is. We're here for each other. And we want to make changes. We want to make changes in your life, in our lives. And just keep moving forward in the best way possible. So I just want to say thank you again for taking the time to listen to me. And I'm really happy to have you as a part of the Grit community. And if you're on the app or on the desktop version of the Grit platform, find me, click on my avatar, say hey, and introduce yourself. And again, just thank you for listening to my story. And I really hope you just know that you're not alone. You have a community. And you need to always remember that your voice and your experience really does matter, especially here at Grit. Thank you.